Hi, good afternoon to all of you. Welcome again to one of our sessions with Ayurvedic doctors. I am Vikram Bir Singh from Ananta Hemp. I'm one of the co-founders. The aim of these sessions has always been to provide more and more knowledge and the experience of our doctors. Today we have Predna Chaudhary, which is a highly experienced Ayurvedic practitioner specializing in lifestyle disorders and Panchkarma treatments. She has more than 8 years of experience. She has dedicated to promoting holistic well-being and restoring balance through authentic Ayurvedic principles. Predna Chaudhary, profound knowledge and compassionate approach have helped numerous individuals to achieve optimal health. She's the owner of Kirti Ayurveda, which is located in DLF Phase 2, and she's been practicing Vijaya for quite some time now. Thank you so much, ma'am, for joining us and taking out your precious time today.
Thank,
I would like to
thank you,
welcome you on this
Vikram. Thank you.
platform. And as you know, we keep on doing these webinars, we keep on
Yeah,
doing these online sessions. The aim of
right,
these sessions are also always to provide more and more knowledge and experience of doctors like you to other doctors. As you know, it's a growing
right.
industry. And
Correct.
Ananta's aim has always been कि maximum doctors के पास ये information पहुंचे so that
Yeah,
they are more and more comfortable with this medicine. Well, welcome
right.
again, ma'am. Would you like to say
Thank
some
you.
words and then we'll start the
Yeah,
session?
thank you. Thank you for having me. And, when I first started Vijaya, so basically I was also fearful where to start, how to start. I have been practicing Ayurveda, but still there was this fear. But then I also have gone through some of the session Piyush sir had hosted along with you. So that had really helped me. And like after introducing Vijaya or like Trilokya Vijayavati or other formulation, my practice has been like improved. So there are there are instant results in the patient with respect to especially pain or stress or
Yes.
sleep. So it had definitely helped me. So I just wanted to share my experience, those who still are thinking to start. So
Yes.
it's the right time, so
Yes. I
there
would
are
like
some
to thank.
cases. Yeah,
Yes, yes,
yeah,
definitely. We would like to really thank Indian Weathers for providing us this platform. And as their network keeps on increasing, we are able to do more and more sessions like this. So,
right.
ma'am, would you like to tell us about your practice and just a little bit of brief history on your experience with Vijaya-based medicines?
Yeah, definitely. As you mentioned, I have been practicing Ayurveda from past like more than 8 years, basically. And my main focus is lifestyle. Basically, those who have digestive disorder, those who have like pain related problem, and pain is also somewhere related to digestion imbalance in your three doshas. I always speak about dosha, but
Yeah.
the main core of Ayurveda is Vat Pitta Kapha, the imbalance. And when we talk about Vijaya, it is one of the best herb which balances vata, which balances kapha. So somehow indirectly it like balances your digestive fire. So there's a toxin accumulation. The people, those who come with rheumatoid arthritis, in Ayurveda we call amvat. So it's not just the pain relief I get. Along with that, their digestive fire get increased. The swelling they have, it get relieved. And they feel active. Overall energy is also there in those people. So. Uh, Such kind of patients I deal. Along with that, I treat like skin hair care problem also, like many other in general. Ayurveda is like solution for everything, and I don't keep myself restricted to that. So I try to help as many people as possible. Rest my Ayurveda or my Sanhita will take care of the things. So yeah, so it's like that.
So,
Yeah,
ma'am, what
and
has
then
been your total experience now with the Vijaya-based medicines? How long have you been using them, and which areas? This we also know as a company that Vijaya-based medicine broadly and majorly works with pain management and it works
yeah,
with lifestyle disorders. Today,
yeah,
we are
yeah,
going to be talking about pain management. So,
right.
what is your experience in terms of time? आप कब से use कर रहे हो ये medicines and pain management में कहाँ पे main effect आया आपको?
So, it's been more than 2 years I've been practicing it rigorously. Like
Yes.
most of my prescription has like one or two like medicine from Vijaya. So when I talk about pain, it's not just about the joint pain or anything. There are like many women, many girls are suffering from dysmenorrhea. Earlier it was like a normal thing for like women, but now with the awareness, they know if there is extreme pain, so it's a problem. So people with PCOD, people with dysmenorrhea, pain during menstruation, so I give the you have a formulation of pain relief like capsule, so I give that. Then those who have indigestion problem, as I was mentioning, like they have distended like abdomen just after meal, they feel heavy, there is like pain in their abdomen, so to those patient also. And when it comes to, as I was telling you, rheumatoid arthritis, arm
Yes.
vat. So to those people I give. And it's not just that, I give to osteoarthritic patient, those who have sciatica problem or many other concern. There is, if there is any stiffness, along with, like, there is this therapy in Ayurveda we call with karma. So when you prick the needle, there is agni karma. So when I do these therapy along with the Vijaya preparation, the results get like more fast. So they the mindset of people which was earlier, Ayurveda will give slow result, it will take time, and also that perspective has started changing because of all these things have started adding, especially the Vijaya preparation. Because Ayurveda always speaks about three dosh. So vata is the main dosha in the system. It is especially in our body, like throughout the body, but it is mostly connected whether the seat is below the navel or is the central nervous system. So people are having, if we talk about emotional pain also, not just the physical pain, so it calms the nervous system. And somehow when it works on your nervous system, when it works on the vata thing in your body, so it gives the calmness, it gives the satisfaction, it gives there is automatic feel of they're getting better, there is relief, there is
So there is
happiness
holistic
comes.
healing.
Yeah, holistic is the right word. So it basically works on that. Along with that, because it is targeting on your toxins, on your ama. So people who are coming with weight issues, they're trying several exercises, they are trying
Yes.
many diets, but still not getting the results. So somewhere the vata and the air and the more of mucus, the kapha is associated. So when it works in the kapha, the additional the toxins, the additional fat also goes away slowly, slowly, along with the other medication. So that is how I try to add in my line of treatment, especially dysmenorrhea cases, especially PCOD cases, because it's not it's not about pain. Also, the apan vayu vegunya, the blockages, it clears the blockages. As now, like most of the Vedyas know, Vijaya is yog vahi, like it act as a catalyst. So when I give it along with any other preparation, it increase the efficacy of that particular herb. Or sometimes I give it as a supplement also, the hemp seed oil, like nourishment. Because if we give medicine like oil based medicine, so that balances the vata is air, that means dryness, so oil will counterpart that. So by introducing these things, by making there's some like dietary changes, by introducing medicine in different forms, so that is how I've been treating patient, and I am getting I'm getting tremendous result because of Vijaya, because of Ayurveda only. I'm just trying, the rest is taken care of by God, honestly. So it's my like small steps I am taking towards that. So I
Great.
have like some, yeah.
Yes, yes, please carry on. Sorry.
So yeah, so I have like 4 5 cases also which I wanted to discuss with, like, just wanted to share. There are many like senior doctors also who will be like watching this later, but the way I started, I was also fearful. But then there were other doctors who had helped me through these sessions. So I just wanted to share some of my cases with where the patient got relief.
Sure.
So yeah, so there is one patient, he was from the army background. So his age was 76. And when he came to my clinic, mostly the problem was like he had hip joint problem, there was thigh pain, then he was not able to walk also, there was like stiffness in the body, especially along with that he had disturbed sleep. We call it like light sleep. There are two kind of sleep, one is the light and the other is deep sleep. But the light one is also disturbed. When he used to wake up, he didn't feel energetic, and there were fear also. He didn't want to come out of his house. He felt like he'll fall, or something bad happened, and all these things. Along with that, there is some digestion issues also. So in that case, I first first I've used uh, Agni Deepan Dravya. Like, first I had worked on his digestive fire also while balancing the vata. So what I've given him is Rasna Sapkam Kashai along with Gandharv Hasadi Kashayam. So these are the Ayurvedic Kashaya preparation. Hello?
Yes, yes, ma'am.
Yeah.
Please carry on.
Am I?
Yeah.
Yeah,
Yeah.
yeah, yeah. So,
Yeah, you're
yeah.
very
So,
audible. We just have some comment coming in. We'll discuss this in a bit right now. आप पहले अपना
oh,
पूरा कर लीजिए.
okay, okay. So, to this patient, I've given Rasna Satkam Kashaya along with Gandharva Hasadi Kashaya. It was like 10 ml each, like morning, evening, empty stomach. Along with that, I have given the pain relief capsule plus Ryudashangu glue twice after food. And then at night before sleep, I have given him Manas Mitram, Vatkam. And then I always try to tell patient to follow a regime, like a dincharya or ratri charya is important. So for that, I have given him nasal oil like Anu Telam, like 2 drops in each nostril. So this medicine was continued first for 15 days, and some local application oil also along with a herbal potli. Like we do the potli massage after
Yes.
the oil. So that was a line of treatment for 15 days. So when he came to me on his second visit, so he said, his sleep was better, the stiffness was gone, pain was still there, but the intensity, when he came to me for the first time, he said he had pain throughout the day, but the intensity and the duration was decreased
Yes.
in the first 15 days.
So
Then later,
as again आप जब catalyst की बात कर रहे हो, that helps reduce the amount of time, and it acts better
yeah.
on that.
Yeah, otherwise, earlier it used to take like 1 month, sometimes 20 days, sometimes more. So here the patient relief and his digestion was also better, his sleep quality was also better, but not to that extent. But then later I introduced some panchkarma therapy also to him, like a shirodhara and some potli massages. The medicine continued the same for 15 days more, and then later I've changed his medicine. Yeah. So then later I've changed his medicine to some rest preparation, where I've given him first is Breathva Chintamani Ras and then Ekangvi Ras, and also like Ras Raj Ras. The dosage was very minimal. I make a Aushadhi preparation, like I make them like I make a powder and then give it a patient. So it was like 250 mg twice. I had given him with honey, because I didn't want it to give him cow's ghee. Normally I give cow's ghee, but then I had asked him to add cow ghee in his dietary habits. So that was the change I made in his treatment. And earlier it was like pain relief capsule, it was twice, then I make it thrice, because I don't give yes, they're in the capsule form, but I wanted to increase the dosage slowly. I don't
You
go
started with 50
rigorously.
mg, you're saying,
Yeah,
twice.
yeah.
Wow.
Yes.
Okay.
Then I made it thrice. Rest of the treatment continued the same. So after 1 month, earlier the oil was Anutelam for his nostril, like Pratimashnasya. Then later I made it for like Shirbala 101. So after that, the patient had given like, he was very satisfied. And if I talk about, sometimes there were patient, after 1 month only, they stopped coming to my clinic. I felt, there was this worry in me, are they like, are they getting the result, or they've just stopped taking the treatment. So my assistant always calls and then asks patients. So, he said, I'm feeling much better. And then I had given the next treatment, like the second one treatment. So I had given it for 15 days. He took it for 1 month, and then he was continuing the same treatment, and he was saying he's good, getting good results. So it's the treatment, like continue, like He came to me like 2 months back. I'm still doing his treatment, but the like he is like already relieved like 60 to 70%. Now I'm giving him like medicine just to manage his symptoms, so that some rasayan chikitsa. Right now, since it's Varsha Ritu, so I'm doing like santarpan, because his body uptarpan, like fasting, intermittent fasting, giving him light diet, because his body is prone to like is like the toxin, so his digestive fire at the moment is weak. So I'm like following, I'm like giving him some dietary advice, and some basic herbs like ashtachurna for the diet, rasna sapkam kashai, all these things. But the Vijaya preparation is still going on. So I have reduced now the line of treatment for that patient. Now the other patient has the same history. She's a female, but then with her it was more of stress related. Something bad happened, and then she started like she stopped doing like physical activities. She was like throughout lying. Then the dietary habits were also not uh, uh, correct. And her age was like 46, and her weight was 52. And but she had a history of like constipation 5 6 years back. When she came to my clinic, she had like extreme knee joint pain, and it was like radiating, not localized pain. There was like extreme swelling also. And along with that, again, sleep disturbed. She had acidity problem. She had like bloating also. Urine was thick. So all these things, complaints she had. Along with it, she has heaviness in her eyes and frequent urination. Feet burning was there. Irritability was there. She was not able to there was stiffness in her joint. She was not able to move when she sits, so there was difficulty. So to her again, then I've given some medicine. In her case, I've given her, first I had given a basic viration, like with patol muladi kashai. Along with that, I've given her arandatelam. So it was like 7 days. So some of her like the constipation get relieved, and she started feeling light. After the 7 days treatment, again I've given her Rasna and Sukumar Kashayam along with Agni Tundi Vati. Then I have given her there's this patent formulation from a brand, Ruma Care, along pain relief capsule. So that
Okay.
was like one each twice after meal. Also Ashtachurna, like a herbal drink. Then I'd given her a laxative like Dashmul Harit ki, 2 tablespoon, like 10 gram at night before sleep, and along with it Nasyam, Pratimash Nasyam Shadbindu. I'd given her Vidkarma and Chonpin Sway, like a potli massage. And for home, I'd given her like a oil for local application also, along with the potli. So she is still like going through the treatment. It's been just 1 month, but when I consulted her on call, her visit is due. So she said, the heaviness is gone, heaviness in the eyes is gone, the frequent burning was also gone, frequent urination, the irritation was also gone, and the sleep has improved, stiffness has gone, but the pain is still there. So all these like improvements she mentioned. Rest of the treatment maybe we'll share in the next session, if we will do
Definitely.
it. So in 1 month only, by introducing Vijaya, in 1 month I can see great result, which which used to take like 1 month, which used to take 1.5 months. Sometimes the patient, when patient come to Ayurveda, they don't have that kind of patience. They want instant result. So now with introducing Vijaya, that has made like easy for me in my practice. So this was the case of a patient. So there were more of pain patient, and then there was this patient, like she was like uh, you know I was doing treatment for her father, so he had like IBS problem. I had given her uh, this our Canna, his sleep pill, along with other Medhya Rasayan and some digestive. So he got like good result. He was not following it properly, but then still somehow he was getting good results. So his daughter was having some, like, extreme pain during period, dysmenorrhea, and she was going, like, she was having this problem since like 8 9 years. So I was in my hometown, so I did her consultation, and then randomly, with some medication, I have given her the, you have this pain relief, the roll on, the cramp relief
The
roll on.
cramp
I
relief.
had like, yeah, that along with the pain relief capsule, and also like a uterine tonic. So that was just basic, for management only, for the instant result. So she got good result, and now like her visit is also due, so to start a proper treatment. So it works instantly also. Ayurveda, people says Ayurveda doesn't do magic, it doesn't do instant result, but it really does, when you follow it properly. So that was her case.
Okay.
Yeah.
So, ma'am, when you have a pain management case, and let's say, I
Hmm.
mean, as you correctly mentioned, there are different kinds of pain, chronic pain, acute pain, or somebody is going through, in women, there are menstrual cramp
Yeah.
cases. And
Right.
then you have, actually some trauma cases. Let's say somebody's broken his hand. So, जब आप एक pain management case का को लेते हो, तो how do you decide कि this is the amount of mg you will start with, and how do you take it up or how do you reduce it back? मतलब ये कैसे एक डॉक्टर डिसाइड करे कि हम उनको इतने एमजी से शुरू कर रहे हैं? तो व्हाट इज
Yeah.
योर एक्सपीरियंस इन दैट कि हम कितने एमजी से शुरू कर सकते हैं शुरुआत के लिए, एंड देन वी नीड टू टेक इट अप और ब्रिंग इट डाउन?
So, to start with, always first you have to consider, you have to do a proper consultation. Then you'll get to know, like, how intensive his or her condition is, what is the weight, what's the age, how is his digestion and all. So on that basis, always start minimum with additional medicine, 50 mg to start with. 50 mg, if you'll give 50 mg twice, that will also be fine, it won't harm. To start with that, I always give it for 1 week, and then I increase the dose for 15 days, and then again I make it like a lighter dose, and then I keep on changing the dosage, so that the patient is also getting result, and I and he or she had like built a relationship. Normally what happens is, it's not about the dosage, it's about the connectivity also.
Yes,
Normally we give yeah, so normally we give medicine for 15 days, not like, uh,
yes,
and then if something happens, then only the patient calls, or otherwise not. But when we practice Vijaya, when we practice in any form, whether it's tablet, capsule, or like, so we keep on changing the medicine, we keep on tapering it off, we keep on increasing it. So the patient also starts building the faith. My doctor is like, like, like she's worried, or she's asking me. So they feel like, so along with the dosage, it builds a connection in the long run, like for the long run. So that is how to start with 50 mg to 75 mg, twice, that will also work. But also you have to see like the patient's age, weight, and the condition. It
okay.
can go
Ma'am,
more, it can go less also.
yes, and what is the maximum dose you would can doctor can go up to, और या ऐसा कोई लिमिट नहीं होता है इसके अंदर, and you have to see case by case?
Definitely it varies case by case. It's, the yukti praman, जैसा आप लोग को लगता है as a वैद्य, you can go to any dosage, you can go for a milder, you can go for a higher dose. There's no precise dosage. So, and it's not about the Vijaya only, there are other like ras
Mhm.
preparation for that, like the general medicine, like the
Yes.
way you consider the dosage of those medicines, same way you have to consider
Yes,
Vijaya
this is something which
preparations.
we have heard from most of the doctors कि जो विजया बेस्ड मेडिसिन है वो आपके नॉर्मल आयुर्वेदिक ट्रीटमेंट का कैटलिस्ट की तरह काम करके उसका टाइम रिड्यूस करता है. आई हैव
Right,
सीन
right.
वेरी फ्यू केसेस वेयर विजया हैज बीन गिवन सोलली या सिर्फ विजया मेडिसिन एक किसी ट्रीटमेंट के लिए दी जा रही है. दिस इज वेरी राइट, एंड हमारा एक्सपीरियंस भी ये कहता है कि ये हमेशा एक कैटलिस्ट की तरह काम करता है.
Yeah,
So,
it does.
do you also give like oral medication with topical medications also, or is it dependent on topical medication भी उतनी जल्दी असर करती है, या फिर oral medication is faster acting and topical is not faster acting? What is your experience say about that?
No, no, it's like the case I had mentioned, the roll on which had worked. So
Yes, the gram.
topical is also equally important, because skin is also an organ. It's the largest organ. It acts like,
Yes.
it has pores. So when we apply externally, it get penetrated, it get absorbed. So vata is all over. So the topical is equally important. So there are patients, those, because it's the mindset. If I try to give cannabis preparation to somebody, and uh, he or she is not ready, so I start with the external application, so they start seeing the result. I explain them. So external is also, as effective as the oral medication. Yeah.
So, ma'am, if some patient comes to you for a seasonal, जैसे winters के अंदर, especially with aged people, knee and joint pains काफी बढ़ जाते हैं in the winter
Hmm.
season. तो आप उसके अंदर सिर्फ टॉपिकल अप्रोच रखते हैं या फिर आपका टॉपिकल प्लस ओरल अप्रोच रहता है टू
It's,
ट्रीट अ सीजनल पेन?
if it's seasonal only, just the topical will work. But somehow there is internal imbalances, so for that, you don't need medication. You can make some changes here and there in his or her lifestyle. So with just the topical application.
Medication will.
Yeah. Yeah.
All right. And we have a comment coming in over here that some Mr. Salesh Sharma has written that I have peripheral neuropathy and I am on allopathic medicines are like Lyrica 150 mg and Tidal 100 mg
Hmm.
uh, since the last many years. So, in
Hmm.
case, what would you consult for a patient like this? I mean, I'm gonna leave my number here so that they can get in touch. But
Yeah.
peripheral neuropathy ka kya, what will be your suggestion on a patient who's been on so many years he's been taking these medicines?
Yeah. So for that, now again, it's complete vata imbalance. Just with the symptom, I cannot tell, what will be the line of treatment and all. But if he or any other patient comes with the same complaint, there will be a detailed consultation. According to that, I'll make a plan. It will be some, obviously it will be some, because it will be some cannabis preparation, but that will be some intense dosage. Again, seeing his or her
No, you're
condition.
you're right actually. अब जैसे आपने पहले ये बताया कि एक पेशेंट की हिस्ट्री और उसके साथ कनेक्ट बनाना बहुत जरूरी होता है.
Yeah, yeah,
And I
yeah,
think it works two ways in this segment when you
yeah.
proper diagnose
And
to do
the
this.
best thing about Ayurveda is, it's personalized. It's unique to every other person. So there's no set of line of treatment. So when the patient comes, uh, see, when patient comes to my clinic, I know, somehow, oh, I have this feeling I'll be writing this medicine. But then
Mhm.
again, because it comes with the experience, his or her prakriti is this, the constitution, which dosha is dominant. Also, why he or she, like darshan, sparshan, prashnan. So when a Vaidya sees a patient, so he know what the imbalance, what balance needs to be made. But along with it, you need to take a proper detailed history to find the root cause, because only not just the medicine will work. There are certain root causes. It may be sleep pattern. It may be like, dietary disturbance. If he or she is not eating on time, he or she eating right but not on time. So there are,
Right.
like, there are causes. So I need to find that, and then along with that, I plan the treatment. And if panchkarma required, I add also, like, because panchkarma also act like Vijaya only, so it increases,
Definitely. The
yeah.
efficacy of the whole program and the efficacy of
Right,
the whole
right.
treatment it increases.
Yeah, yeah,
What
yeah.
about the long-term use, ma'am? A lot of doctors ask us this question that कि विजय हम long-term use कर सकते हैं या नहीं कर सकते? Is it habit forming? और या कल को tomorrow, if a patient is on a long-term use of Vijaya, will he get dependent on the medicine? And will it be a problem जब उसको हम Vijaya से taper off करते हैं? So what would you say
No,
about
it no, no, no. Again, the THC and CBD ratio is such, so it is not habit forming. Along with it, you need to take the medicine under, if anything, with respect, if we'll just eat sugar for long time, and the quantity on our own without even considering, any other person, so it may harm. But when it comes to Vijaya, if you are taking it in proper under guidance with your Vaidya, So it doesn't harm, it is not habit forming, and there won't be any harm. In fact, it will not just help you with your disease, it helps in building your immunity. It just doesn't work as a catalyst on your medicine, it acts as a catalyst on your food also, on your
Okay.
thoughts also. So it's like the holistic, so it doesn't know. But then
Okay. So
you have to be in contact with your Vaidya, from who, or like whoever
definitely,
you
I
are
don't
taking.
think patients should treat themselves, and like
Yeah,
because the Ayurvedic doctor has they establish a much bigger connection with their patients because as you
right,
said, कि हर एक patient का unique scenario होता है. So I completely
correct.
agree with that. So what about long-term side effects, ma'am? Anything which you have noticed, or if there are any side effects to use Vijaya-based medicine on a long-term basis?
There are some very little, there's, if there are some like dizziness, there are some like, um there are like sometimes indigestion problem can also be there, or dizziness or nausea, which are very mild, but that can also be that can also happen rarely, not frequently. So I have not seen, to be honest, like in my practice, I've been practicing like Vijaya, especially from 2.5 years, not that long. But there has never been a case who has complained me regarding, like, I am
Yes, even
having this medicine. Sometimes, rarely, with me, no, it didn't happen, to be honest.
yes, our experience also says the same. All the doctors, ki sometimes the patient missed doses or sometimes misuses the medicines, then they have a little bit of
Then,
digestion issue or a little
yeah,
bit of sedation or sleep. But as such, there
yeah,
are no notable long-term side effects or anything. In fact, patients who are on painkillers, especially chemicals like tramadol and
yeah,
ultraset type of medicines, they have a
yeah,
long term effect on the kidneys and the liver, जो कि हम जो
yes,
हमें वेजिया में बिल्कुल भी नहीं देखने को मिलता है. एंड
नहीं
उसके
मिलता है,
compared to that we can actually use it for a much longer period and keep the
longer period
patient
of time.
on this medicine.
Yeah, correct. Yeah,
Okay, thank you so much, ma'am. For your time today. I think we will catch you again on some next session, and we'll talk about some other ailments, and we will
yeah,
talk about some
definitely.
lifestyle disorders and other areas which we use in the medicine. Thank you, and thanks to Indian Vedas once again, and
Yeah.
thank you so much, Doctor Saab. And we would like to connect with you as soon as possible. And thank you for your time again. Thank
Thank
you.
you, Vikram. Thank you, Indian Vedyas, for having me on this platform. I hope this session was like useful and
Definitely, ma'am.
beneficial
Our
for
vision
everyone.
is to just put this session out there in the public so that a lot of doctors keep on seeing this, and we try
Yeah.
to keep different topics on different sessions so that the maximum knowledge is thrown out. And I'm really
Yeah.
glad that you came here today and we had a talk on Vijaya based medicines. Thank you so much, ma'am.
Thank you. Thank you, Vikram. Thank you all. Have a good day.